next 5 years or so, I'd like to see us cure more patients. And I think curing more patients means treating patients in the adjuvant setting to increase our chance of cure, but also recognizing these patients that have relatively oligometastatic disease. What are the curative approaches to those types of patients, and how can we incorporate more of our definitive immunotherapy into those settings? For our patients for intermediate and high-risk disease, can we get to CR? How can we get to greater complete responses for those patients? How can we kind of layer on therapies, not necessarily on top of each other, but sequentially before disease progression? These are all, I think, really important questions. I think lastly, we need to find how to treat non-clear cell cancers better, and there are some studies going on. We need to accrue better to those treatments. The PAPMET study is probably one that's going on right now that's very interesting, but I think we're going to need to understand, one, is MET really the new standard for papillary cancers? And then if it is, how do we put immunotherapy into that? And what are we missing? What's different about clear cell besides MET and other targets? Can we find ways to engage the immune system even greater against those tumors? So yeah, a lot of work to be done. I think there are other immunomodulatory targets in renal cell. I'd like to see those move forward quickly into those frontline spaces. That's where we're going to see the greatest effects.